Question 1. A to E assessment of David's COPD exacerbation, airway. Patent but shows increased work of breathing and accessory muscle use, indicating potential risk if his condition worsens. His respiratory rate of 30 breaths per minute would further compromise his airway. Bronchodilators can reduce respiratory workload. Crawley ETL 2016. Curtis ETL 2024 suggests pursed lip breathing to slow exhalation, keep airway open longer, and ease breathing. Breathing, critical state with SpO2 at 78% on room air, below the recommended 88 to 92% range. For COPD patients, Curtis ETL 2024. Auscultation shows diminished breath sounds, wheezing, crackles, and accessory muscle use, indicating compromised airflow. Melby ETL 2021. ABG results show elevated CO2, indicating hypercapnia and respiratory failure. Kraft ETL 2022. Curtis ETL 2024 recommend oxygen therapy aiming to target the required range, with regular ABG and pulse oximetry monitoring. Bronchodilators are crucial to increase airflow. Crawley ETL 2016. Circulation, heart rate at 128 beats per minute, and BP of 168 over 85 millimeters of mercury, suggests tachycardia and hypertension. Capillary refill of 3 seconds and cool peripherally indicate impaired perfusion and possible infection in his febrile state. These signs reflect a hypoxic response, with increased heart rate compensating for reduced oxygen delivery. Yatsu 2020. Recommended interventions include continuous ECG monitoring and bronchodilators like salbutamol to reduce bronchospasm. MIMS 1996, thereby improving airflow and indirectly alleviating cardiovascular stress by enhancing oxygen levels. Vignol and Vaglamer 2018. A troponin test is advised to assess potential heart muscle damage. Medline Plus 2023. Disability. David's GCS score is 14 over 15, confusion and distress, indicating moderate neurological impairment, likely caused by hypoxia. Curtis ETL 2024 state that changes in consciousness such as agitation or anxiety can suggest inadequate ventilation or cerebral hypoxia. In respiratory distress, they recommend controlled oxygen therapy to maintain SpO2 levels between 88 to 92% to improve cerebral oxygenation and cognitive function. Wang ETL 2022 add that bronchodilator treatment can enhance oxygenation, helping reduce neurological symptoms. The authors also suggest ongoing neurological assessments are crucial to detect any further decline that might indicate CO2 narcosis. Exposure. Febrile status suggests infection, supported by purulent sputum, elevated white blood cell count, and elevated C-reactive protein levels. Fever increases metabolic demand, worsening respiratory and circulatory stress by raising oxygen consumption and CO2 production. Abel 2020. To manage these issues, Abel 2020 suggests antibiotics like azithromycin, antivirals, and antipyretic treatment to reduce fever and alleviate metabolic demand. Question 2. 4 high-priority interventions to manage David's COPD exacerbation. 1. Administering controlled oxygen therapy is critical for David, given his dangerously low SpO2 of 78%. Improving oxygenation is essential to prevent hypoxemia and respiratory failure. Nishi ETL 2015. Note that oxygen therapy improves cognitive function, reducing hypoxic pulmonary hypertension progression, and alleviates heart and lungs strain, thereby slowing disease progression. Controlled oxygen therapy is vital to safely deliver oxygen without increasing the risk of CO2 retention in COPD patients. Nishi ETL 2015, making it the top priority due to his compromised respiratory status. 2. Administer bronchodilator therapy. The rationale for this intervention would be bronchodilators like salbutamol and ipratropium to relieve bronchospasm and improve airflow by relaxing the muscles around his airway, reducing bronchoconstriction, reducing the work of breathing, and addressing the underlying airway obstruction in COPD exacerbation. COPE 2014. This intervention helps stabilize Mr. Nazal's breathing and is crucial for immediate respiratory relief. 3. Monitor and manage infection with antibiotics and antivirals. Administering azithromycin is essential for Mr. Nazar due to signs of infection, including fever, elevated white blood cell count, and purulent sputum. WISE 2024 state that antibiotics help control bacterial infections that can worsen COPD exacerbation. Antivirals like lemetravir and ritonavir target any viral infections, reducing the overall infection load. WISE 2024. This combined approach addressing both bacterial and viral causes, stabilizing his condition and preventing further respiratory decline. 4. Position David in high Fowler's position. This method is crucial for managing his COPD exacerbation. According to Envetsoglu and Leifetti, 2022, elevating the head of the bed between 60 to 90 degrees improves lung expansion and reduces diaphragm pressure, aiding in breathing by increasing chest cavity space. The authors also state that this position decreases the heart's workload by reducing venous return and lowers the risk of aspiration, helping stabilize David's condition and reduce his respiratory effort. Question 3. Nursing considerations for following therapies. Oxygen therapy is crucial for David due to low SpO2 and ABG levels. Maintain oxygen saturation between 88 to 92% to prevent CO2 buildup. A common issue in COPD. Curtis et al. 2024. Using low-flow devices like nasal cannulas between 1 to 3 liters per minute, or high-flow devices like Venturi masks between 6 to 8 liters per minute, adjusted to stay within range. Bill 2022. Monitoring should be guided by pulse oximetry to ensure accuracy. Curtis et al. 2024. Possible side effects include dry nose, fatigue, and headaches. Medline Plus 2019. Salbutamol. Assess lung function and monitor for respiratory status changes, especially due to COVID-19 infection. Shake and prime the inhaler if unused for over 5 days. The standard dose is 1 to 2 puffs, with close monitoring. Side effects include trembling, a fast heartbeat, or severe reactions like irregular heart rhythms and low potassium levels. Nursing considerations would be to educate Mr. Nazar on proper inhaler use and cautioning against overuse, as well as checking for medication interactions such as with beta blockers are essential for safe and effective treatment. Information from MIMS 1996. Ipratropium, Atrovent. Assess his respiratory status, including breath sounds, heart rate, and oxygen saturation, while considering conditions like glaucoma or urinary issues. Educate him on correct inhaler or nebulizer use, emphasizing eye protection and not exceeding 12 puffs in 24 hours. Monitor for side effects like dry mouth or dizziness, and be alert for severe reactions such as swelling or chest pain, which require immediate attention. Emphasize the importance of following his dosing schedule, reporting any increased medication needs, and proper storage and disposal. Information from Medline Plus 2017. Prednisolone. Assess for allergies, heart disease, and hypertension, ensuring no contraindicated active ingredients are present. Medication should be taken with food to minimize stomach issues, with a typical dose of 20 to 40 milligrams daily. Monitor blood pressure, heart rate, and blood glucose, as corticosteroids can affect cardiovascular and metabolic status. Watch for interactions with current medications, especially for heart conditions, to prevent complications. Regular monitoring is essential to ensure his treatment supports recovery with minimal side effects. Information from MIMS 1996. Azithromycin. Assess for any allergies to the medication or similar antibiotics and review Mr. Nazar's history for heart issues, particularly QT prolongation or electrolyte imbalances, common in COPD patients. Administer a 500 milligram IV infusion over at 60 minutes for 2 days, followed by oral azithromycin to complete a 7 to 10 day course. Monitor for side effects like nausea, vomiting, dizziness, and fatigue, and especially cardiac effects like irregular heartbeats or QT prolongation. Nursing considerations include ECG monitoring, checking liver and kidney function, and educating him to report severe diarrhea or skin reactions promptly. Information from MIMS 1996. Nirmatrelvir and ritonavir assess kidney and liver function due to contraindications in severe renal or hepatic impairment. For moderate renal function, adjust the dose to 150 milligrams nirmatrelvir with 100 milligrams ritonavir every 12 hours. Treatment should begin within 5 days of symptom onset and continue twice daily for 5 days. Review current medications for interactions, especially with CYP3A metabolized drugs like amiodarone and simvastatin. Monitor side effects like nausea, vomiting, diarrhea, headache, and taste changes, with immediate action for serious reactions like liver issues or anaphylaxis. Nursing considerations include monitoring respiratory status, heart rate, stool, and organ function. Information from MIMS 1996.